meeting, whether it be good or bad. We want to hear from folks. What is your perception and how is it working? So we did hear some themes for Tea Time with Templeton. We've kind of combined those with some other things we've heard at board meetings. And really, we've got a couple big questions that people have on their minds. Number one, how are you making decisions to open school in the future? How have you made decisions to have small groups at this time? What are the plans for hybrid learning in the future, and when is that going to happen? We'll do our best to answer that one. There's a lot of unknowns, as we all are aware, but we'll give you all the information that we know and be transparent about that. Another question that we've heard consistently is, how are you ensuring safety for staff and students when you have anybody in your buildings? And we do have students and staff in our buildings right now, as we are open for small groups, those farthest from educational justice, our highest need students, and our staff is there working with them. So how are you ensuring safety protocols and routines for that? So Mr. Hanson will answer that question, and then we'll move to Assistant Superintendent Renee Burson, who will help us understand what are the supports that we are providing academically for students, and then what are some successes and challenges that we are having as it relates to teaching and learning. And then we'll kind of wrap her up with Mr. Hanson coming back to what are we doing to balance and respond to the social, emotional, and mental health wellness of our children. My friends, it is a true issue, no doubt about it. And as every other superintendent in the state of Washington and nationally is trying to balance the weightiness of the academic, social, and emotional progress our children need to make, as well as the safety as we are still currently in a global pandemic. So we'll talk a little bit about that and let you know some of the things we're working on. This is, by the way, this is our mid-semester check-in. As we are working on school improvement for the district, this is part of our action research cycle that you'll see embedded in school improvement plans, strategic plans, superintendent goals, as well as the school board's goals, is that we set the plan, we implement what we believe works, and then we are checking on it, we're monitoring for progress. And that's what this is. What we've discovered, which is a standard response, is that many of the things that we're doing are working, and there's some things that aren't working. And so that's what we're here today to do, is to figure out what those things are and make some adjustments for the future. If I don't mention it now, I will later, hopefully, if I remember. Somebody help me remember. We did send out a survey yesterday to our parents. And we're asking you some of these questions. We're asking you what you think would be the most effective or helpful as we process social, emotional, and mental health of our children. We're also asking you if and when we go to a hybrid learning model, and we're not there today for sure, but in the future at some point, would you want to return in person part-time, because that's what the hybrid model is? Or would you prefer to stay completely remote until such time as you felt more comfortable in the future? So we just kind of want to grab that information from you. That helps us inform the future. So let me start with when are schools opening? So currently we are using the guidelines and the recommendations from the Department of Health, as well as from OSPI and Labor and Industries. We are also consulting and coordinating with our local health officer, Dr. Melnick from Clark County Public Health. I meet with Dr. Melnick every week, and in fact, sometimes twice a week, as we are coordinating and processing current infection rates, percentages of increased contagion, looking at what that means in reference to us and what the safe opening of schools might be. But the Department of Health has given us a decision tree, and with our current infection rate of 100,000, per 100,000, we're today 254. That's well in excess of what a hybrid recommendation would be, which would be less than 75. So again, we are working with those folks, and we're making forward momentum. As you might have noticed, we brought back our kindergartners, and that was 2 weeks. This is week 2 of our kindergartners being back with us. Now they're in very small groups, and they're not coming every day, but we've got our younger learners getting in-person limited service on our campuses. We are planning actively for a hybrid model in the future. So when we get the go-ahead that it's safe to do so, then we will plan for that. Currently, as you can, everybody, it's in the news every aware, the governor has restricted lots of activities in the state of Washington. Our COVID rate is rising exponentially. Our county health officer is very concerned. This is a national trend as well. So we're paying attention to that. And currently what we're doing is working with our small groups, and we're going to be holding that pattern until such times as we see something different from the recommendations and or the COVID infection rate goes down. Again, I would ask everybody who's on this call and everybody who can connect with a neighbor, if we could all mask up, stay socially distanced, and follow guidelines, I believe that we can get our kids back in school. It's a top priority for all of us, and the sooner we get the infection rate down, the sooner we can be back in person. Okay, so there might be some more questions about that later, so make sure you put those in the chat. Right now, we're going to move on to safety. Mr. Hansen, what are we doing to make sure that we are ensuring safety?
Thank you, Dr. Templeton, and I do appreciate being a special guest. I think this is my first time being a special guest, so thank you. So obviously training, safety, health and safety is a major component of our plan. It was initially in August when we presented our plan to the school board and to OSPI, and it continues to be. And I feel very good about where we are in our buildings with safety and in the school district. And in August, it was a very daunting task thinking about how we're going to get our buildings set up to match the Department of Health, L&I, OSBI guidelines, and also what the governor is asking us to do. And again, I feel very comfortable and confident that we're there. And we have individuals who are in our buildings every day, checking to make sure that we are following the procedures and protocol that we've put in place. That includes me. The last couple of days I've been in buildings, and again, I'm feeling very good about what we have. So the safety starts with, again, following the guidelines that are established by the Department of Health, by Clark County Department of Health, and that begins with training for us. So we started our school year training our staff in the COVID protocols, and that's for all of our staff. That includes our new staff. We've been recently trying to train up more substitute or guest teachers, and so any one of our new staff members receives the same training that's provided. So we start with training. That's training for our teachers, for our support staff, for our bus drivers, our transportation personnel. All of our staff receive training. Our custodial staff, working with Debbie Kelly on protocol for cleaning. So then we look at our protocol. So protocol begins when students get on the bus. Protocol begins when our students and staff enter the building. So for example, if you were to enter any of our buildings, what you would notice is that we have first signs that ask for people to do a health screening. And every one of our staff members and every one of our students is required to have their temperature taken. So that's very important, that not only do they have required to wear a mask, but we're taking their temperature. We're asking parents and middle school and high school students to, before they even those are to be on site, come to school to do a self-attestation. So using the health screening app on Skyward to first answer those questions that are so important that whether you've been around someone, if you've had symptoms, and making sure that if you're not feeling well, we do not want you to come into our building. So we've really been encouraging students and parents to consider that before coming to our buildings. All of our staff, the same expectation. Our staff are to do a self-screening, self-attestation prior to coming to the building. And then once they come to the building, they sign in, they get their temperature taken. And so that sign-in is used in case we have a situation with someone becomes symptomatic or a close contact for our contact tracing. So that's our protocol for anyone just entering the building. We have limited the access to our buildings. We are discouraging parents and volunteers at this point. Occasionally we do have a parent come in. We use the same protocol, but we really are discouraging people who are not directly associated with what's happening in the building to avoid coming into the building. Protocol also includes for our custodial staff and cleaning. So we have strict protocol when we have a situation in case we possibly have someone who is symptomatic. The protocol that we follow as far as cleaning that space. We have protocol in what I've seen in all of our buildings for example, for a classroom that's been cleaned, it says on it that classroom has been cleaned. If it's a classroom that needs to be cleaned, there's a red sign or some sort of marking that says this room needs to be disinfected. And so those are very important. Protocol for once entered in the building, the direction of flow. Protocol for meeting the social distancing expectations. So we have in our buildings, we have arrows for directions of flow. We encouraging students to walk and anyone to walk on opposite sides of hallways. We have markings for the social distancing. So all this protocol is very important. And I can tell you that I have individuals who are supposed to be watching and notifying me, and I have individuals who are notifying me and feeling free to let me know when they've noticed where we're not adhering to our protocol. And that's very important, and we appreciate that feedback because we know we need to get better because safety is crucial. So we're constantly working on our protocol and listening to what's going on. Masking, social distancing, those things that Dr. Templeton mentioned. So as far as the masking goes, we provide our staff with masks. When the masking expectations changed, then we up those expectations. So instead of just using a cloth mask, we use KN95 masks, and we use shields when necessary. So we're fully staffing or providing our staff with the PPE that's necessary. When it's necessary to increase the PPE, we do that. Every one of our buildings, so you know, has an isolation room that's been identified. So if we do have a student or a staff member who is symptomatic, then we have our nurses or someone that has been trained support those individuals, but get those individuals to our isolation room. And then as quickly as we can, we want to get them out of the building and home. If it's a staff member, then to follow our process when that happens. We are in the school district taking on the contact tracing responsibility, and we've been doing that for several weeks. And we're continuing to improve our ability to act quickly when we have a situation where someone has been either symptomatic, found to be in close contact, and then tracing if it was someone that was on site, what does that look like? Who are they in contact with? And then communicating out. I believe that we've been very responsible in our communication and really kind of communicating more than we probably need to, but we want to make sure that everybody knows what is happening. And again, always being cautious of information that we can share, as this is not information that is for everyone, especially when it identifies individuals. So we're continuing to train, improve on our protocols, adjust when we need to. Again, we are open to your feedback. For example, with transportation, our buses need to have windows down, and I have people regularly letting me know whether that's the case or not. And so parents that are listening, if your child is riding the bus, our windows are down, and that's to create airflow or more fresh air, but it means the buses are going to be a little colder. So we want our students to dress warm and be ready for that. I thought it would be good to mention also with just increasing airflow. We've been working with our HVAC system and following up with vendors that support us in as much as possible bringing in fresh air. So we've opened up our dampers, so we're bringing in fresh air that to the limit of our systems, and we think that's also going to be helpful, as well as opening windows when possible. Thank you, Dr. Templeton.
Yeah, thank you. I would just like to add that we've heard some suggestions from parents, and we've taken them up on that. In fact, this tea time with Templeton, we were thinking we would continue on with coffee with Mary Renee in the future, but a parent let me know that there's a need for communication at this level. So thank you to the parent who, you know who you are, that suggested this. So thanks for that. Also, we heard that we don't have enough information on our website that speaks to these specific details that Mr. Hansen just identified. So in the course of the last week or so, we have updated our website. So if you were there a couple weeks ago and couldn't find what you were looking for, give it another try. We've added quite a few things with the details. All right.
I just want to add to that one of the things that Les just had added, which is our close contact or symptomatic, when we believe we have a close contact, and our contact tracing protocol. So that very detailed on the process that we use when that happens.
Excellent. All right, we're going to turn the mic over to Renee, and she's going to let us know what's going on in the world of teaching and learning, engagement, and successes and challenges. Renee?
All right, thank you. So I appreciate everybody who's here, and again, just mirroring those statements that were made by Dr. Templeton and Mr. Hansen. We really appreciate your feedback and take that into consideration as we're making improvements. So start out, we spent some time over the summer just improving our distance learning model. We really wanted to capitalize on what we learned in the spring and think about how do we make this better. And so we listened to parent feedback. All of our principals attend training on the distance learning playbook, and that was designed to really provide them resources to provide effective instruction in a virtual environment. So that's been woven into the training that principals provided before school for teachers and also PD throughout the year. Teachers have really been focused on developing those routines and procedures that can support students in distance learning. So we've seen we have some students who are thriving in this model. We have some who appreciate more control over the pace of lessons. They can go back and rewind lessons that are recorded. They can work in their own space that they've developed, and they control the time when they can approach the lesson. So they have some flexibility there. This also works well for some students who have experienced anxiety in a traditional school setting. That being said, we also know that we have students who are struggling. This is not the way we typically have school. And so part of what we're doing is supporting all of our individual students' needs. So our promise to know, nurture, and challenge all students, we take that very seriously. And so thinking about how do we give support to our students who are struggling in this environment. So we've given some support on students who can't access due to technology. So Les Brown has been really active in making sure that all of our students have their technology needs met. We have one-to-one devices. He's provided hotspots to families that need hotspots for connectivity. Knowing our students, so having re-engagement teams at every building where students who are struggling, those individual teams are meeting and coming up with individual plans. That might be counselor connections that are being made. Reaching out to individual students and finding what are some of those barriers, how can we support them more? And so those interactions are taking place where there are individual plans that are being set up. We also know that some students in secondary especially have been struggling with grades. And so we have at the high school and middle schools, we've set up some meetings where we're talking about how can we support students more? What does that look like? So more frequent check-ins. Counseling support, academic plans, in-person learning for some students. We've also talked about how can we build in more social interactions for our middle school and high school students so that they feel more connected in the school. We did some data analysis recently to correlate what's happening with students who are struggling and are not passing some of their classes. And we've seen a high correlation between attendance during synchronous learning times and passing grades. So that's something to be aware of, that students who are attending those synchronous lessons are passing almost double the rate of students who are not attending those synchronous lessons. So that opportunity to engage during the synchronous time is really important. It's also come to our attention that there are some students who are not being challenged. JMS recently did a survey out to family to ask about the level of work that's being provided. And 19% of families said that they felt like it wasn't challenging enough. So that's about 1 in 5 students. That's a significant number. So we took that to heart and started planning, how can we engage students? And so we've reached out to WSU Vancouver, and we have pre-service teachers who are interested in helping us plan lessons that would be more engaging. We have some middle school teachers who are also going to support that work and do some planning on lessons that can be used that are more engaging for students and more rigorous and could be extensions. Our teaching and learning department here is working to share resources. Parts of the curriculum that may not be accessed regularly for teachers, but are there to provide enrichment. And so just making sure that teachers know what resources are available for them and that they're easy to access. And we have instructional coaches that are collaborating. They're working to create a menu of options by grade level that teachers can access for extensions. We've also asked for community volunteers to be guest speakers and mentors. And so reaching out to the community and asking what they can offer our students and our teachers, and making sure that we put them into places where they can support work that's in our classroom and build that partnership with our community. And if you feel, as a parent, if you feel like your child is not challenged, the first thing to do would be communicate your needs to the teacher. All of our teachers are dedicated and they're working to know, nurture, and challenge all students. And so first step would be let the teacher know. And then I appreciate too, at my level, knowing that we need to support teachers with more resources. And so if they're not being challenged, that gives me kind of the signal that I need to put more resources in the hands of teachers and make sure that they're supported so that they can provide instruction for all students that meets their needs and challenges them. Secondary team has been meeting regularly. We're collaborating and planning for more engagement and just learning from what we're hearing from families and also what we're seeing in classrooms. And so teachers are trying strategies, and some are very successful and in different areas. And so we're learning from each other. Like if your PLC team, your group of teachers has done something to engage students that's been really successful, we want to hear about it and make sure that we can implement that in other classrooms and share what we know. So that's one of the things that we're doing, is making sure that we're sharing as teams. We do have some innovative and creative solutions that teachers have been working with and principals have been implementing. So sending home some materials so that students have hands-on materials in front of them as they're participating in a lesson. So I was in an elementary classroom the other day where they had baskets of materials that were there as they did the math lesson. So they referred students to those materials. We have culinary kits that are going home for the high school and for Washougal Learning Academy for their elective. And so making sure that all students have access to those materials that they need for some of those hands-on courses. We have teachers who have prepared STEM kits to go home for families. ESD has partnered with us. They provided kindergarten STEM kits for each student. And so those are resources to make sure that we had hands-on learning that's still happening. Some math manipulatives have gone home in the middle school, which is a great example of a lesson in our Bridges class where students were sent home just cardboard squares to come up with some problem-solving activities to support that learning with find the square root of 21. Which is a really challenging problem because the squares don't align neatly when you look at 21. So having students that introduction to irrational numbers in a way that makes sense. We have some labs that are done virtually. So our curriculum supports virtual labs for 6th to 8th grade. Amplify Science has a lot of virtual labs that are available for students. At the high school, we have some virtual resources for our science teachers as well. There are virtual labs happening in physics and biology, and we're doing some research on how we can support chemistry with some virtual lab opportunities. Margaret Rice, our director of CTE, is working on solutions for our CTE department. How can we make sure that students are still receiving the learning that they would receive in those hands-on departments? And so that's ongoing work as we're trying to make improvements. Virtual field trips have been happening. So I actually just yesterday attended a virtual field trip for 3rd grade students. So Wolfways came in and presented information to our students. We've had ice cream factory field trips. So other opportunities where we just want to make sure that the learning's coming alive for students. Community members are helping us make connections as well. We have CKLA is our elementary language arts curriculum, and there's a unit that is on mind and body. And so there was a connection to our library. There was a book that was read all about students' brains. Our community fire department created a video on how firefighters protect their brains and wear helmets, and how students should be doing that if they're on bikes or participating in those type of activities. Some other success stories, we've had high levels of engagement in elementary Zoom meetings. And so we're really looking at some of those successes and thinking about how do we modify some of these things for students at the secondary level. What we're really seeing is that relationship building is key. And so at the elementary level, 30 minutes every day is spent in class meetings. There are community building activities that are built into those lessons where you have opportunities for student collaboration, and social opportunities like sharing that you probably wouldn't see at a high school level, but how do we build in those social opportunities that are age appropriate? So those are some of the things that we're working on now. Our secondary principals have reported a lot of success with individual outreach and making those personalized plans for students. Just today, I was able to hear some of the small victories that have been happening at the secondary level. I know staff have been really engaged with thinking about how do we engage more students and what can we do to get better at this. And so today there were some staff that were sharing out. One teacher let us know they had 100% attendance in their Zoom class today, and that was a first. So they're pleased with some of the actions that they're taking to make some changes. Another report that more students had their cameras on today, so that helps with the level of engagement. Another student had said they're attending asynchronous classes even if they don't need the additional support that they're going in to support other students and encourage others. So we appreciate the role that students are taking actively to support each other as well. And I think we see that. I think Mr. Hansen will talk a little bit more maybe about the ASB involvement and some of those other things. So those are all ways that we're supporting students and making sure that that their needs are met, both their academic needs, and we know that those are not separated from their social emotional needs as well. So making sure that we're keyed into what students need so we can know, nurture, and challenge all of our students to rise.
Thank you, Renee. I appreciate that. Just kind of as an agreement, we are recognizing that many of the things we're doing, they are working, but when it's not working, we are hearing from our patrons, our parents, and we're making adjustments. And that's what Renee was just describing. A lot of the things that she's leading, a lot of that right now in the last week or two has been very focused on student engagement. A lot of that at the secondary level. We're seeing high success at the elementary level for the most part around student engagement. So thank you, Renee, for that work. Thank you, parents, for letting us know what we need to work on. We appreciate that. Mr. Hansen, we're going to zip over to you. What do we got for social, emotional, mental health support?
Yes, thank you, Dr. Templeton, and thank you, Renee. And Renee, I think went over a few of the examples of things that we are doing, and so much of this does overlap as we look at our students and what supports them and how do we get them engaged. And we are very concerned about our students' social emotional wellness. And we started the school year and we continue to work with our staff on creating learning opportunities for our staff to instill more culturally responsive practices. So that's been very important to us. And so those culturally responsive practices, our goal is to create a community and a culture within our classrooms where our students feel supported, they feel safe, and they feel included. And so much of the work that we have done on a professional development level has been to work with our staff on the cultural competence. And so we're hoping that our students are seeing that, and parents, you are seeing that. We knew going into this year, we didn't know how long we would be in remote, but we knew that this was going to be a challenge to support our students social emotionally. The things that we have done in the past with our social emotional curriculum, that is still happening, but I don't think it's having the impact necessarily because of our situation. So some of the things that we are doing, each one of our buildings has a re-engagement team. So that re-engagement team is not only looking at our attendance and who's checking in, but we have systems that communicate to the engagement team concerns for students. And then the re-engagement team in some cases are actually going to homes and seeking out face-to-face interactions with students. So in our buildings, we're identifying students that we're concerned about. As a school district, we've invested in our guidance counseling. And so we added a counselor at Jump to Guard this year. So we have 2 counselors. And so these one-on-one opportunities are available for students with our counselors. We also have partnerships with CMAR, Real Life Counseling, and they're doing virtual counseling sessions that are taking place. And so that's happening in many of our buildings. We also have prevention intervention specialists that are part of our building teams, support teams. Renee had talked briefly about the climate and culture team at the high school, and also connecting with ASB, and Mr. McGarvey, who is our athletic director, who is really focusing his attention right now at the high school on getting students more engaged and working with our ASB. So it is our ASB students our leadership students that are helping us right now gather the information that we need. As Mary said, we're at 9 weeks, 10 weeks, halfway through our semester, and we're noticing that we are not seeing the engagement that we want to see. And that looks in different buildings, that looks different, but I think across the board, we're looking at screens that are on. And so when we're seeing screens turned off, it's hard to tell what kind of engagement we have. So we're really encouraging as much as possible students to turn those screens on, and so we can see them. And so that is one of the metrics we use. And again, we're not seeing the level of engagement that we want. So at the high school, they're putting their ideas together to create opportunities. One of the things that we did do that a couple of weeks ago was add athletics. So that was very helpful to increase engagement, is to be able to have our students come on and participate in practice. And so for a short time, we had some students in sports in the gyms. We are now back to outside with masking, but that's helpful for engagement. We have virtual clubs meeting. So I had an opportunity last week on Friday to meet with our Black Student Union at the high school. That's a club that meets regularly. JMS has Club 8 meeting regularly, and they just invited 4th and 5th graders to participate in Spanish. So I was in the meeting that Mr. Cook talked about that. And that Club 8 is not only for Jump to Guard and Canyon Creek, but now for 4th and 5th graders. So that's helpful. And so we want to be able to get that information out to parents so their students can connect virtually to Club 8 and what Club 8 is all about. Some other ideas that we've talked about, we're looking at what other buildings are doing in other districts and partnerships, and just seeing what's working. And so again, at the high school, they are working on developing their plan for any kind of virtual get-togethers, assemblies, and some other ideas that we might be able to adhere to the social distancing expectations, but also create opportunities for students to come in contact with each other and staff. A couple other examples that have been shared is at Jump to Guard doing lunch buddies with the counselors. That's happened recently. 5th grade, CAPE hosting a social time on Fridays. 3rd graders at Hathaway, lunch groups in breakout sessions over Zoom, and similar JMS teachers running breakfast buddies. So we are working on this. We recognize this as a challenge, and we are seeking your input as well. If you have ideas that you think will help us in creating more opportunities for our students to connect with each other and just develop stronger relationships with our staff.
Well, thank you, Mr. Hanson. Appreciate that. I would just like to highlight, if you're at the high school level as a parent, here are some of the clubs that are currently meeting. Some are meeting every week, some are meeting a couple times a month, but these are opportunities for your children to get involved and get kind of back connected socially. ASL Club, Book Club, Drama Club, French Club, Knowledge Bowl, Science Olympiad, FBLA, Skills USA, Spanish was already mentioned, and then the International Club, just to mention a few. So there are opportunities, so we would encourage you to connect with the high school, and we're also asking the high school, with Mr. McGarvey leading the work, to make sure we're advertising these opportunities that are ways for our kids to get together when they really can't get together physically, it's just not safe. Again, this is a large project. I'm sure that you can all appreciate that because you've been doing the large project at home. If you're a parent out there and if you're a teacher out there, you've been doing the large project at home and at school simultaneously. So again, thank you to everybody for your efforts and your work toward this mission that we will indeed know, nurture, and challenge all of our students to rise. Not easy stuff, not easy at all. Again, we have a lot of complexity out there. And I will just be completely transparent when I tell you I have families that are telling me I'm going way too fast, way too fast. Slow down, it's not safe. Why do we even have one student or one staff member on campus? I have other families saying you are not going fast enough, speed it up. We would like everybody back to have those same fruits of the K-12 public education that we maybe didn't appreciate enough before. We want those back. So again, there's a lot of opinion. I am not an epidemiologist. I would maybe say I could be maybe a social scientist in some degree or fashion, but I am just like every other superintendent. We are listening to those that have an area of expertise around what is safe and what is not safe. Again, we mentioned earlier using the Department of Health and Labor and Industries and OSPI and the CDC. And those are certainly groups that's what they do. That's their expertise. They are the scientists, and they're letting us know that there's a lot of things they're looking at to make sure that that when it is safe to bring back more students, then we can do that. So I'm going to stop right there, and I'm going to let Les kind of take over. I see that there's questions. I can see there's numbers in my Q&A. So, all right, Les, what do you got? We're ready.
So the first one dovetails actually kind of nicely off of what you just talked about, which is from Shelby. So in regards to opening schools, are you gaining opinions from officials outside of Washington State and or Clark County? And there are some guidance from the CDC that says that they do not recommend closing schools. And how does that play into the decision?
So yes, we are getting lots of guidance from folks outside of Clark County as well as outside of the state. OSPI put together a task force at the beginning of this project to determine what would be safe, what would be the guidelines and the restrictions or the allowance for safe openings of schools. And they went to national groups as well as international. As you can imagine, the entire world is grappling with this. And so gaining information from what others are doing and successes that they've had. As it relates to the CDC, what I can say is that I'm looking right now at their most current recommendations, and you can certainly pull it up, and maybe Les can pop into the chat box if you want to, or Mr. Hansen. But there are indicators, and this is specific for school opening, and they're telling us that there's that low risk all the way to the highest risk of transmission in schools, which is what we just can't support. But when you look at that, they are looking at the same thing that we're looking at, which is the number of 100,000 of cases in the last two weeks. They look at the percentage of positive tests. All those in reference to Clark County, we're way over in the red. If you know that coloring scheme, we're not in the green. They ask us the one place where I do believe that we're nailing it, and that's in our mitigation factors. And that is one of the key requirements. Can you verify with fidelity that you're distancing, masking, using proper hygiene, that you're using attestations, making sure that folks are not coming on campus that have symptoms, making sure that you have protocols and routines if somebody happens to get on campus who's infected, having isolation rooms, et cetera, that you're actually taking people's temperatures when they walk in the door. If you're doing all those things and you're sanitizing and cleaning and you've got a schedule, they tell us that those are critical and they should be considered. Again, we're nailing that one, but in reference to the other factors, we're not there. And then they go on to indicate another 5 or 6 factors, and that's hospitalizations. It's on the rise. Dr. Mellick's telling us that the hospital beds are becoming less and less available. I know in skilled nursing care, he's already been telling us those are not available. I'm just like turning my page here. So, public settings where there's outbreaks, I think Halloween was, if I'm just being frank here, that was a problem. We've got Thanksgiving coming up right in front of us. In the meantime, I've got the governor who did pull us back technically from athletics. We had just moved into the buildings. We had girls b-ball going. We were very excited. We were texting pictures. They were all very socially distanced, and that was an exciting part for us and the kids. And then the governor said, nope, that one we can't be inside anymore. So we respond appropriately, and I told the basketball team, if you guys want to dribble outside, that's great. A lot of what our kids need, and you already know this, they need to be together. They don't have to be within 6 feet, and they should have a face covering, but they need to have that social interaction with each other. And these are ways for them to do that. Whether we win a state tournament, and by the way, there are no state tournaments this year, it really is not the biggest issue for me as your superintendent. I'll say that publicly. It's any opportunity that we can get to offer our kids a chance to connect from a social perspective, whether that be via Zoom or out on the field, or a group of our drama club kids who are outside socially distanced. There's lots of opportunities. We're taking a thought.
Can I interrupt you and start one of the other questions? Thank you.
You're like, stop talking, Mary Templeton. All right, fair enough. Fair enough.
It's a recurring theme. So for anyone, so this is for anyone, I'm gonna give it to Renee, I think. Do you frequently sit in on the Zoom calls, and what do you think about the engagement between teachers and students?
Yeah, we actually just had a formal opportunity to go and visit classrooms and sit in on Zoom calls. We're starting up our board site visits at this time. Typically, we go and visit buildings and we go into classrooms. And so I've been both in person and in virtual classrooms. And so we just finished the visit of Columbia River Gorge Elementary, and we're able to pop into 4 different classrooms and see what's happening with learning there. But on a regular basis, we have principals and myself that attend those Zoom meetings to see what's happening and make sure that we're supporting teachers and giving them the resources that they need and seeing what that interaction between students and teachers is like. And so I think we've addressed a little bit about this in that in the Zoom meetings for elementary, it looks like we have more engagement. We have more students whose screens are on. Students are participating more regularly, and we're seeing at the secondary level that we're struggling a little bit there. So that's why we've come together as a team and really been focusing at the secondary level on how we can build more strategies to engage students at that level. So where we've seen some strength in elementary, we're seeing maybe it's not working quite as well with our older students. And so how do we provide those supports that are age appropriate? And so that's really what we're working on now, is how to improve engagement at the secondary level.
Yeah, if I could just add on to that, again, in full transparency, we heard from teachers probably 3 weeks ago. We were talking, I don't remember what meeting, and this is what I heard. So I'm teaching a lesson and I have blank screen, blank screen, blank screen. My heart starts to pound. I'm very overwhelmed. I'm not even sure what is my next move. So we know that's a real experience out there, and that's why we're taking some really proactive steps right now to get in front of that. What kind of engagement strategies can we help you develop? That particular teacher who told us that, that person then put together little kits for the kids to come pick up so they could do some labs offsite, and they could do them together virtually. All right, done with that question. What's the next one?
Just one thing to add on to that. And I just want to address, there seems to be like an easy solution that would be just everybody turn their screens on and make that mandatory. But what we see is there are some family circumstances that don't allow a screen to be on. There are also some circumstances with technology. I know even where I live, if I'm at home, I can't have my video on and interact in a Zoom meeting. It's almost like everybody else has a meeting and then I just dive bomb in at odd times because my connectivity lags. And so turning off the video helps with that. So there are some real reasons why we don't have screens on. And then there are some other reasons that students might share that are unique to them as to why they don't have their screens on. So we're trying to make sure that we're respecting student need and also developing strategies where we can engage students. A great example was a 5th grade teacher who had students who were responding even though their screen may be off. She set up this expectation that students are responding. So during the time I observed in that classroom, even though students had their screens off, they were responding to questions that she asked. So the expectation is you respond, or there's a call that goes home so that the parents know too that the student was not engaged in that lesson, so that we can prevent students from having the screen on and disappearing, or the screen off and disappearing. We want to make sure that even though we don't see them, that they are engaged in the lesson. So that's one way of doing that, is to make sure that there are opportunities to engage and respond even if your screen is off.
We also determined, Renee was running some data, that the children that are participating in their synchronous lessons are doing better academically. So if we know that to be true, then our teachers are going to continue to work on that engagement, and we would ask our parents to also help us. Renee also shared this anecdote. Sometimes the juniors and the sophomore students at high school might not be as willing to get onto that Zoom if they didn't have time to get the look ready to go, where those first graders, they don't care if they have bedhead, they're right there. And the engagement is very high in our kindergarten and first, second, third grade classrooms. They're not worried about hair yet. Anyway, but if you parents can help because I raised 3 of them, get them out of bed early, get them organized so that they're ready and prepared. That's one of those 21st century skills that we're also trying to teach our children: responsibility, punctuality, and respect, right, for the process and the teacher. Les, got anything else?
Yeah, sure. So this question is for Dr. Templeton. It's about the legal and liability and financial risk of varying from the guidance from the health department, and how much, how much liability is there and who holds us liable for that?
So I think I've heard this question before, which is it true that the health officer, Dr. Melnick, is in charge of school districts telling them when they can open and when they can't? The answer is no. Dr. Melnick is not in charge of the health, of telling us to open or to close. Now, there is a time where the health officer, because there's an epidemic or an outbreak within a facility, the health officer then will come in and say to the superintendent, you're closing, and then I wouldn't have any power to say otherwise. But other than that situation, the health officer's role is to advise, to offer recommendations, and to share information about not just what's happening in schools, but what's happening county-wide. Same thing goes for at the state level. Liability, we have a responsibility to be fiscally, to manage our resources, and part of what we do is to mitigate liability. That is what we do a lot, and not just with COVID and safety, in all aspects of things that could go wrong. That's what we are consistently responsible for. So when we get guidelines from the Department of Health that's informed by the CDC, that's telling us that this is when it's safe, this is when it's not safe, recommendations, we're going to be thoughtful, and we're going to be responsible. We're going to respond to those recommendations. I will tell you, however, that we felt that it was appropriate to keep moving with small groups, kindergarten being the last group. I can clearly tell you that there were folks in this community and within the school district that said that's not the right move. We don't think that we should be doing that. You're going too fast again, Dr. Templeton. But we, looking at the guidelines and the recommendations, it fell within those. And so we said, yes, we're going to move on that. So you can count on me to make those kinds of maneuvers when there's an opportunity. I don't shy away from conflict, but I'm also very thoughtful and I'm measured, because I have to be responsible as I manage the district.
Okay, so this next one is, currently there are situations where different teachers are distributing assignments, requirements, and even connections in different ways. What is the plan to support secondary teachers and parents in monitoring progress across different platforms, requirements, and assignments? That's probably a Renee question, maybe?
Yeah. So we have actually met as a secondary team to come up with a strategy where those assignments should be shared in a similar way. So basically making sure that all of the assignments for their Google Classroom are consistently shared. So sounds like we have some more work to do on that and making sure that consistency is there. So we'll be meeting as a team to follow up on that. It was recently that we developed a system for that, where students could go to find their work and be able to link in to their Google Classroom and be able to find those assignments. And so making sure that that link was at the top of their page and readily available. So we'll be revisiting that and just seeing what other support we need to make sure that that's consistent, because we know how much parents rely on that consistency through their classroom, so that you don't have 6 different instructions coming home for your students. So we'll be revisiting that and looking for ways to improve consistency.
There's got to be a question for Mr. Hansen, please.
Why do the buses not follow the same rules with regard to social distancing?
All right. I know the answer to this one. Do you know the answer, Mr. Hansen? Can you take it?
Well, yeah, I can. And yeah, so the guidance supports that students in riding the buses don't have to be 6 feet away from each other, that those trips typically, I think on average, are shorter than the 15 minutes. But we have done, I would say, substantial work with the transportation department and trying to mitigate as much as possible the risk by having students wearing masks and spacing as appropriate. And we have had a couple of examples where maybe we used a bus that was smaller than we could have used. So we continue to be adjusting what our practice is. Students need to wear masks. Drivers are wearing masks. When we can, we have them sitting as far apart as possible. Again, that's sometimes we're limited with that, but we are working on that as well. But the reason is because the guidance allows us to have students sitting closer than 6 feet. It would be very difficult to miss 6 feet.
Yeah, and it was based on the duration that they're typically short trips. Now, that's not every single kid, but most trips are short, and that's that close contact component. The other issue is that the windows are open, and because of the velocity of the vehicle, you have a lot of ventilation coming in, and this is an airborne virus, and if you can get the air purified and get it out, that helps. So that would be the answer to that one. All right, I'm ready. How many more questions? Go ahead.
A couple. We have a handful more questions, but
The only reason I asked, sorry, I just want to make sure that we have a way to let folks know who ask questions that we'll be able to respond to them on our FAQ in the future.
Right, so we're going to be looking at the questions that came in and developing answers to them if we aren't able to answer them today. And we will add those to the FAQ document that's out on the district website. So in the scrolling banner that's at the top of the page, it's under the red button for COVID. And it's been there for ages and ages, but we have updated that FAQ with a lot of the guidance that's coming in. So with the increased social disconnect this school year, what steps are being taken to support and lead teachers in providing extra support and connection that students require to continue their academic growth and excel this year? I think that's an Erin question, kind of.
If we had time, maybe Erin and Renee. So maybe what are we doing to support students differently? But also then what are we doing to stretch students or those students that might feel that the workload isn't quite sufficient, that they could use maybe extension? Go ahead, you guys.
Yeah, so I'll speak a little bit to just some of the things we're doing to challenge our students. So I spoke briefly about this, but it's come to our attention that we have students who are looking for some challenges and extensions. And so we've been meeting as a team to discover how can we support that more broadly. And we're partnering with WSU Vancouver. Some pre-service teachers are supporting us to build some lessons that are more engaging and have extension activities that would be more rigorous. And so we also have middle school teachers who are planning some extension lessons now. And our teaching learning department is preparing some resources that are extensions with the curriculum that we currently have that may not be readily accessed for teachers. So we're making sure that those resources are put in the hands of teachers. We also have our instructional coaches who are working on that. This moment in time, we actually met this afternoon to discuss that a little further on how we can support teachers more with extension activities. We know that our teachers are very busy and they're really looking at how do they support each student and differentiate for students. But the more support that we can give them and resources in their hands, the better. So that's where we're focusing our attention, is how we can build those extension activities and get those materials and resources to teachers that need them. Students who are struggling, that's another thing that we're focusing on at the secondary level, thinking of how we can build in some more social interactions for students, how we can make sure that the relationship between student and teacher and student to student is developed, and how do we do that in a way that still allows time for academics. So I think we have two things that are vying for attention right now. One is this feeling of there's not a lot of time to deliver academic content, and then the social connection as well. So how do we find balance for both of those things to happen?
And I just want to add that we intentionally built into our K-5 schedule, 8 to 8:30 is where class meetings happen. And I think that's a great opportunity for our students to connect with each other and whether to connect with our teachers. And so looking at the possibility of how do we create those opportunities in the secondary level, is it through asynchronous time? And just as Renee was saying, helping our teachers in identifying not only the students, but then what kind of support can we provide those students that we've identified. So that's continued work that we're going to be looking at, but really appreciate that question.
Yeah. And I know that we're out of time, and then I will let Les kind of wrap us up with any of the details for the future. But let me just say, first of all, thank you everybody for your participation. When Renee and I were going out doing our coffee chats, we didn't even have close. Well, actually, a couple times at Gauze, we had a really large crowd. So thank you, those on the meeting that were there. We appreciate that. We would love to be able to meet in person, but nonetheless, we're hoping that this has been helpful. We're doing it again in December, which is right around the corner. So if you didn't get your questions answered on this, we're going to try to get those on the website. You can attend the next one. And then there's always the opportunity to connect with me personally if you're not feeling like you're getting your questions answered from the principal, from your child's teacher, or the counselor, we will certainly make sure that we are listening. We will not always have the perfect solution, but we want to listen and figure out how to problem solve forward. I will then end really with this. As our infection rate and our hospitalization rate and our percentage of positivity were really in those manageable areas, we were very optimistic, and we were planning aggressively to move into those next phases, the hybrid being the big goal, where we have all children back on campus at least a couple times a week. Unfortunately, things just continue to escalate, and I think it caught our local health officer as well as the state by surprise. And we are in this current situation where we went from 171 to 254 in 1 week. We are anticipating that to be over 300 next week, says Dr. Melnick. He also tells me that if we don't change the daily infection rate, we'll be over 800 within the next couple of weeks. So we're not going in the right direction, but I know if we in Washington, especially here in Clark County, if we can do what we need to do to keep the virus from spreading, masking, distancing, et cetera, that we can get our kids back in school. And that is the #1 priority. And opening up other things is important for our economy, but getting our children back in school in person is our #1 priority. And I stand behind that. I stand also as a legislative advocate for the school district around the influence that our legislators can also have on this process. Again, thank you. I know we're at 5:01, so Les, I'll turn it to you to make sure we have everything taken care of as we exit.
Yeah, so thank you, Dr. Templeton, and to our special guests, Aaron and Renee, and to everybody who participated in today's webinar. I forgot to mention at the beginning that we did record most of the meeting, and we will post that out on the district website probably tomorrow after we work through fixing the closed captions, which never spell Washougal correctly. And then we will try to work on also updating the FAQ page, which I put a link into the chat box. You can check that out over the course of the next couple of days. We'll try to elicit some of the other themes that are in the questions that didn't get answered and put those out there. So stay tuned for our next Tea Time with Templeton, which is on December 16th. That's a Wednesday next time at 4 p.m. You can find the link on the district website. That's at www.washougal.k12.wa.us. And it is in the upcoming events section, or you can find it on our Facebook page. We are at Washougal_SD. Thank you all again for being here, and have a great evening.